That's how precise this is. And it makes sense, right? It's bad enough I have to deal with Time Warner, which I have proof of today in a horrible way. But right now there's a CNN. Kids with COVID, rising numbers. Apparently it was published 2 hours ago. So that'd be around, what, 6:20? Hold on a second. It is 3 minutes and 4 seconds long. And I can't help but remember the 403. I'm going to listen to it right now.
University of West Virginia suspending more than 24 students and shifting most classes to online only following a weekend of holiday parties. As many students from college age to kindergarten start classes in earnest following Labor Day, an alarming new report adds to the concern among top doctors about COVID cases among children. According to the American Academy of Pediatrics and the Children's Hospital Association, COVID cases among children shot up more than 17% between August 13th and 27th, with more than 70,000 new child cases in that time span across the U.S.
We know that there have been numerous outbreaks on those college campuses, leading to hundreds of cases on even individual campuses. So I think that this is really in the context of kids acting a little bit less safe, and as well as the college campuses and the K-12's opening.
Video obtained by CNN shows a large outdoor gathering at Penn State University recently, many students not wearing masks or distancing. It prompted a stern warning from the university's president, bluntly asking students, quote, "Do you want to be the person responsible for sending everyone home?"
Right now, the key to Penn State staying open is the behavior of every single one of us.
At Ohio State University, more than 200 students were recently suspended for breaking the school's COVID-19 rules on socializing. And NC State University recently announced it's reducing its on-campus housing population because of a rising number of coronavirus cases there. In Georgia, Mississippi, and Utah, thousands of students and hundreds of teachers have recently been asked to quarantine because of exposure to coronavirus. Experts say the increase in child cases could also be a result of more children being tested in recent months. The new report says despite the climbing numbers, severe illness from the virus is still rare among children.
The bad news is that when a child gets sick with COVID-19 and winds up in the hospital, 1 in 3 of those children needs the ICU because of how severely ill that they get with the disease, especially if they have a whole body inflammatory response where their immune system just really goes out of control and causes widespread illness.
Experts say even with this new information, there's still at least one crucial set of data that is unknown regarding children and the virus.
What we still don't understand is how much kids are a vector for this and how much they are the index case in a given household. So in fact, we don't know how much kids transmit this disease.
So given this new report, is it time for school systems across the U.S. to start shutting down en masse? Well, the experts we spoke to say not really. They say in communities with low rates of the disease, schools can be kept open safely as long as they adhere to strict rules on mask wearing and social distancing. But they say in those communities with high rates of coronavirus, like some communities in the southern U.S. right now, it's simply not time to have kids back in class yet.
It's well known that within the last, week, there was another report by the American Pediatrics Association that had a very specific metric. And I found 3 references to it, including on the American Pediatrics Association site, as well as CNN. And they did this thing in that I just watched it cold. I just watched it with you. They have this thing where, the subheads at the bottom are referencing the surge plan. And I have not, I don't believe I've made a video about the whole surge plan, but I've been following it for 2 years. And this is always alarming. But they did this thing that I've been saying is very significant and is one of the reasons why the current National Director of Intelligence needs to be fired. In Texas, they have this driver's license program where for several years it was required by law for Texas to have a separate program for people that were 24 years or older. And Texas just didn't do it. Still, we're going into the 3rd year where Texas was required to have a separate program for adults 24 years and older, and they just didn't do it. If you were over 24 years, they said, well, just do the young drivers. And the young drivers was from ages 18 to 24, and the teen drivers, I think, was from 14 or 15 to 18. They just were collapsing everybody together. And my concern was that what they were doing is they were normalizing people to accepting age-inappropriate pooling. That the risk associated with being from different age groups for certain activities is so significantly different, and the kinds of things you're exposed to is so significantly different, that when it comes to compilations of data, and when it comes to things like assessing vectors, you need to have distinct quantification and categorization procedures. Not only that, we still have not responded to whatever they thought they were doing when they allowed the Environmental Protection Agency in January of 2017 to release its protective action guides that completely misrepresented and miscalibrated data concerning exposure of a radiological incident and how to address exposure of a radiological incident specific to children. I've been reporting on this for years. Nobody seems to think that it's the kind of thing you respond to with as much concern about, well, how are we going to assess what kind of vector we can target in order to understand where the algorithm is going to next provide the biggest surge we have to deal with. That's what she just said. She's not saying anything that has to do with actual medical science or medical necessity. And she's not talking anything about what were the precipitating factors that allowed for this risk level to accrue, while CNN is doing this practice, which is probably, I believe, one of the most dangerous things that has happened, which is allowing for risk leveraging and vector compositions that are completely age inappropriate, especially when you're talking about medical science or medical data, when you're talking about allegations of public health care response needs based upon potential for infection or potential for a fatal incident as a result of infection. They just completely collapse everything in together. What are college students and K through 12 students being lumped into consideration as a vector concerning back to school? We refused for over 20 years to deal with appropriate age-specific parameters around consideration of what young people should be exposed to. They just showed a little blurry, but the pictures of those children in hospital beds on ventilators is not so different than a video I saw 3 months ago of a nurse who worked in battle situations, an army nurse that was in New York, reporting real time how horrified she was about what the implications of putting somebody with COVID-19 on a ventilator are. How many children are being put on ventilators, and how many children are being prepared to be murdered on ventilators?